Hi, I'm Dave. I had bariatric surgery in December of 2012. Dr. Shadle was my doctor, and this is my story. Now, there's a lot of reasons why I had the surgery, but mostly was the fact that I knew that I was suffering from a lot of physical issues in my life. I had been suffering from diabetes for many years, and my doctors, both my regular doctor and my diabetic doctor, told me that the medications I was using were not working anymore. And I still remember my diabetic doctor getting knee to knee with me and said, I have patients who no longer have feeling in their feet or have no feet or are suffering from kidney or heart disease. He said, Dave, you're not there yet, but you're not far away. You've got to do something drastic. But more importantly, it wasn't just so much that I physically may change or that I was going to get healthier for myself. I have 7 children, and of which 5 of them are married. And I have 6 grandchildren with 1 on the way. I began the process of finding out what I had to do. I remember contacting someone in your office, and they sent me this paper of all the things that you have to do in preparation for it. But when I finally made that decision, it happened in about 90 days. And Dr. Shadle was very easy to work with, and he worked his schedule around. He did whatever he could to make sure that I got it done before the end of the year. I remember the day of the surgery, going in there, and I was just amazed at how well I was treated in the hospital. And then the surgery itself coming out. I know Dr. Shadle said that it was picture perfect. I wasn't in any pain. My frustration at the hospital was I wanted to get out faster. And I was also very concerned about how long I would be missing work. And I remember having the surgery on Tuesday, and I was back to work that following Monday. What could I do now that I couldn't do before surgery? Being able to bend over and tie my shoes. I mean, that sounds silly, but it is. Cross my legs. I get up without groaning, just getting up off the ground, playing with my grandkids. Well, my support people, first of all, is my wife and my children at home, but all my children have been very, very supportive and mention how proud they are. And that's very nice. Before surgery, there was times where my blood pressure or my high sugars, I would not sleep well. And I would be very, very drowsy during the day, and there was times that I missed work. My wife would say I wasn't very happy, wasn't happy with myself, and I hated shooting myself with the medication or taking the pills, and then all of the side effects to those medications. And that was before. Since then, I sleep much better. I wake up early. I have a lot of energy. I don't think I've missed any work at all, and I remember I've ran. I haven't ran since I was a kid, and even as a kid I hated it when they told us to go out and run the track. But I run all the way down the street here. It's about 1.5 miles to the end of the street and 1.5 miles back, and I run it, and I didn't feel bad, and I wasn't out of breath, and I enjoyed it very much. And I still do a lot of walking. Not only does it help you physically, but emotionally and spiritually, and it helps get your life in order. So if I was to give anyone some success type of a story, it would be, first of all, get your mind in order, figure out what you're doing, where you're at in your life, what you're going to miss out if you don't have this opportunity, and then take full advantage of it. Regardless of what the cost or time involved, just do it.